I know you can see my picture on the website. I'm the program director for the Occupational Therapy Doctoral Program. And thanks for all of you for joining us. It's great to have you and for your interest in Johnson & Wales. We think we have a pretty neat program. It's a new program. This is our second year. And we've just been really building a program that we feel is really going to prepare students to be in the occupational therapy arena, for the next decades. We're trying to make it very forward thinking. So I will introduce some, you probably have already interacted with Mary Piniella, who is our graduate admissions coordinator. Hello. And sorry, anything else from you, Mary?
No, just hi, thank you for joining, and if any questions come up regarding the admissions or application process, feel free to reach out to me. You might have already received emails from me, so feel free to contact me anytime.
And Dr. Rebecca Simon is our academic fieldwork coordinator.
Hi, everyone. Yep, my name is Rebecca Simon. I am really excited to be in the Johnson & Wales Occupational Therapy Program. I have been at Johnson & Wales since 2017 when I joined the physician assistant faculty as an interprofessional faculty member, which was really exciting for me. I was able to interact with the PA students and really got a good feel for the university. And so when the occupational therapy program opened up, I was asked to come and continue a role that I was very comfortable with. I'd been an academic fieldwork coordinator for about 10 years at my former institution. And prior to that, I started my career as a pediatric occupational therapist. So that's my specialty area. And I just found the teaching bug and was really excited to start to teach. Pediatrics is where I started, and eventually over the years, I became a full-time faculty member and academic fieldwork coordinator. I've been able to sit on many local, regional, and national committees related to fieldwork, which is a huge part of the occupational therapist education. It's for those that don't know, it's basically an internship time period at the end of your courses, which we'll talk about a little bit more as we get into the presentation. But my job is to manage all of those rotations and fieldwork experiences. And I'm really excited to be here. Very happy to be a part of this, what I consider to be a really, really amazing program and the first and only of its kind in Rhode Island. So welcome to everyone.
All right. And is Dr. Currie here as well?
Yes, I am. I'm sitting right here.
Okay, so Dr. Linda Currie is our newest faculty member, and she teaches courses related to physical rehab, kinesiology, geriatrics, neuroscience. Do you want to say hello?
Sure, I'd love to. Thank you for joining us today. I'm really pleased to be here. I am a new faculty member and actually a new faculty. I've been a lifelong clinician and my background is in the physical sciences. So I've always enjoyed working with clients who have had strokes, clients who have had brain injuries, clients with Alzheimer's. I've worked in geriatrics. I enjoy driving rehabilitation. So I have a lot of hands-on experience to bring with me, and that I enjoy sharing with students and hope to share with all of you at some point. So welcome, it's good to have you here.
Okay, is there anyone else on the Johnson & Wales side? I don't think so. I will just say, this is Dr. Dooley again. I have been an occupational therapist for about 30 years. It's hard to believe. And my main focus has been on education for the last about 20 years. I have taught at all levels of the profession, from associate, bachelor's degree. I started and directed a master's degree program previously, taught in another bachelor to master's degree program as well. And I have been at Johnson & Wales for about a year now. And I've been the program director for most of that time. So we really have a very supportive community within the college. We are part of the College of Health and Wellness, and we have a really vibrant, in normal times, atmosphere in Providence, because you are right downtown. So my clinical background is in mental health and geriatrics. I've worked in acute care with people with mental health problems. I've worked in more longer term care in terms of day programs for people with mental health challenges. And then I've also worked in long-term care in terms of skilled nursing facilities, which provide both long-term and short-term rehab for the generally for the older population. One of my clinical specialties is in dementia and cognitive impairment, and in assessing cognitive impairment. And I have done some research work on a new assessment tool, and have done some publication also, and extra training related to working with families of people with dementia who are in their homes. People are always trying to stay home as long as possible, but it's a very, very challenging situation oftentimes, and occupational therapy is one of the professions that has some very strong evidence to support its use with that population. So I'm looking forward to doing even more of that in the future. Okay, and Amanda has joined us as well, who is another student, okay, also from Massachusetts. All right, I think that we will go ahead and get started with the presentation. So Dr. Simon is going to start us off.
So if you are with us today, it is because you have an interest in occupational therapy, which is a good thing. So we thought what we'd do is start off just by giving you some details that we want to share about occupational therapy and some resources. And as we've sort of alluded to already when we've introduced ourselves, occupational therapy is really a place where you can really work with just about any population. As you've heard, Dr. Currie worked with adults in home care. We've had some older adults. I have pediatrics. But really, occupational therapy is the only profession that helps people across the lifespan do the things that they both need to do and want to do through the use of through the therapeutic use of daily activities. So while we address the needs of individuals of all ages, we look at really how occupation, which in this term, we're not using the term occupation to mean vocation or what you do for work. Occupations are things that occupy your time. From something as simple as waking up in the morning and brushing your teeth, to a leisure activity if you like to play tennis, or if you are interested in a certain hobby, that's an occupation. So what we look at is what you want and need to do in life, and how we can use the things that you love to help you either habilitate or rehabilitate. And we'll talk about those terms a little bit later. So we enable people of all ages, and we love to say to live life to the fullest by promoting health and preventing illness, injury, or disability Or once you have that, we help you to, if you've had an illness, injury, or disability, we can help you rehabilitate or live better with those conditions. Next slide, please. So again, as you've heard, we have a very holistic perspective. We don't just look at the condition. So we might not say, this is a broken wrist, so we're going to treat the broken wrist the same no matter who we work with. We look at how that wrist fits into the person it's attached to. So sometimes it has to do with making sure that that wrist is stronger and more able to do what it needs to do. We call it range of motion and strength. But we also might look at the environment. If we can't get the wrist to do everything we want it to do and fix the problem, we work at compensating or adapting around the issue. So we can look at the environment, we can look at tasks that the person can do in a better way to prevent further injury or to help with the injury that they already have. So for instance, an example I like to give is if I am a 40-year-old woman who is a mother of 3 teenagers who breaks my non-dominant wrist, my treatment is going to look very different than a 22-year-old student at Johnson & Wales who is left-hand dominant and needs that hand to write with, or maybe a 32-year-old mother who has an infant who she's got to diaper and take care of, and she's a hairdresser as her primary occupation. So you can see how the wrist fracture is the same, but we put the person at the center. So we really think about how our treatment is really tailored to that person, what that person needs. And also the second component is how the mental health of that person might be impacted by the condition. So again, in those same examples, as a 40-year-old mother of 3 teenagers, I might still be able to get out of the house because my son drives me where I need to go, and I work at, you know, a place that I don't need to really use my wrist. But if I am a single mother of that infant, I might start to get some other components of role change and depression, or some other factors that the wrist fracture influences my mental health and well-being. And in addition to that, we also might work with people who solely have mental health issues to try to help them get back to their leisure and their occupations in a different way. So we really look at each individual person, the environment that they're in, we call it the context that they're in, and how they can be a true part of the therapy team with us. Next slide, please. As far as the job outlook, occupational therapy has received a lot of accolades in the past few years. I remember when I started as a therapist in 1997, I used to have to really explain what occupational therapy was to almost everyone that I met. And now I believe that occupational therapy is being recognized far and wide because of all of the wonderful things we're able to do with such a wide population. We'll talk about some of those populations in a moment, but as far as the job outlook, because we know that's what students are looking at, we're number 13 in their ranking of the 25 best jobs of 2019. I anticipate similar rankings in 2020. Again, we're the 50 best jobs in America, and most importantly, the Bureau of Labor and Statistics really predicts a 24% job growth in our area through 2026. And so that's an increase of over 31,000 jobs for occupational therapists. So again, as we talked about, occupational therapists work with a variety of different clients, from pediatric to adults, to those with mental health needs and those with physical needs, in prevention, habilitation, and rehabilitation. And as you can see, these are just some of the possibilities that are at your doorstep. So we have the very traditional areas, but there are occupational therapists that work in higher level of administration and can use our skills that we've gathered as occupational therapists to become managers and to think about populations needs and managing individuals that aren't even occupational therapists, but using our skills at remediation and compensation, which is fixing the problem or working around the problem as administrators. Many of us are in higher education, so that is definitely an option with a doctoral degree. advocacy, really thinking about client and patient advocacy, even as high as, lobbying to Congress for different rules and regulations and law changes. We work with work capacity. So even though occupation doesn't mean vocation or work, we also look at people who have gotten hurt on the job or have been hurt and can't go back to their job. And we might do an assessment of how they might be able to go back to their job, or even in prevention, look at ergonomics, which is how to set up your work environment so that you don't get hurt. And that's really a great thing to do for nurses, for office workers. There's so many opportunities for occupational therapy to step into the work environment, both on the end of helping to fix a problem that already exists or helping to prevent a problem from happening. And then again, we have geriatrics, mental health, physical rehab, which are all the standard components. And we also consult, we look at driving, and it says there are endless possibilities, because what we're encouraging our students to think about is where, with the skills of an occupational therapist, can you work and how can you be successful? And we really do think that an occupational therapist's mind can work in any environment.
I think another exciting component of that, and this is Dr. Currie, is that if you're going into the field of occupational therapy and you planned on spending your entire career on it, you might end up starting out in pediatrics and loving that field, and then 15 years later feeling like you need another challenge and deciding to move your way into work capacity or working in geriatrics or moving up into administration. So there's a lot of flexibility in our profession so that you don't get burnout as much. There's always a new challenge around the corner that you can rise to. And again, if you really like that hands-on person-to-person component, it's an excellent field to go into.
It's a great profession for anyone who doesn't like to be bored every day. I don't think I've been bored a day in my life as an occupational therapist. And we often say, my job is not to be an occupational therapist. I am an occupational therapist. It's who I am at the core of my being. And we want that for our students too. It will become who you are. And that's really exciting. And we encourage all of you to, consider the fact that every day you wake up with a new challenge and a new problem to solve. So it's exciting. Dr. Dooley will talk now about our program in general.
I will. Okay, so I would have to agree with those comments and also point out that there are many occupational therapists who have been vice presidents of hospitals, deans of universities, and in Rhode Island right now, an occupational therapist is the president of one of our major hospitals and one of the absolutely leading psychiatric hospitals in the country. So that's pretty neat. So my role here for the next few minutes is to talk about our program. So we know that you have a choice in, getting a master's degree or a doctorate. And we also know that you have a choice of where to do that. We'll talk to you about some of the things that make our program unique and we think desirable, for those reasons. So we are a year-round program. Students go to school in spring, fall, and summer semesters. There are breaks throughout the year, and there is generally a little bit longer break at the within the summer time component, like in August. We have a cohort model, which means that you would stay with the students in your group. And right now we are capped at 24 students. So we are really looking right now at a pretty small program that we know will allow us to give everyone individual attention and for people to really feel at home. And our start is in June. It's usually the second Monday or so in June. which gives people that are finishing up their bachelor's degrees enough time to graduate from there and get moved in. Right now, we did start this June cohort online, and our plan is to go back in person on July 6th. And the college has other, arrangements made as far as safety and all of the pandemic response issues. You can find all of the details about the program here at the link, and we will let you go ahead and click on that at some point, but we can go to the next slide. So a couple of things that we feel make our program different are the things that we focus on and our curriculum threads. So one thread that runs throughout our curriculum is an emphasis on occupation. We feel that occupational therapists should be relying on our basic tool, which is helping people, as we've been saying, do the things that they need to do and want to do. So if given the choice of a rote exercise, for example, or having a child just practice handwriting, it would be a lot better. We know from many different types of research, outcomes are improved when we use occupation. So that is one of our focuses. Another focus of the program is intra and interprofessional collaboration and education. So intra-professional means that we will expose you to some work and collaboration with occupational therapy assistant students. And interprofessional will be the bigger component, in which you will have the opportunity to work with students and sometimes even professionals from a lot of other professions. So they may be designers, they may be engineers, they may be people in the culinary field or dietitians. They are traditional healthcare folks as well, physician assistants, nurses, physical therapists, speech language pathologists, audiologists. But we really, at Johnson & Wales, have a number of different programs that we feel are clearly touching occupational therapy. And the last one that's unique is the equine programs. So Johnson & Wales has a whole equine center with a few different academic programs. And they have just started a new focus on therapeutic use of horses. So that is not here in downtown Providence, but it's in Rehoboth, Massachusetts. So as we go along and are able to be back out in the community face to face, we will be very happy to get back to the barn every now and then. We also have some local therapists who specialize in therapy by use of a horse, which is also more commonly known as hippotherapy. So we have a lot of potential collaboration there. So with our curriculum, you will start with foundations that provide you with a common ability to speak about occupational therapy, use the same language, understand the theory, and understand the basic sciences mainly that are underlying it, such as human development, kinesiology, which is the study of movement, how the brain works and develops and allows us to function through neuroscience. And the other foundational courses also include things where you're being educated about human conditions. So you're learning what is the normal body and mind and social growth of people, but then you're also learning about what will and can go wrong with people. After the first couple of semesters, you move into a sequence of courses related to practice. So each practice course has a lecture and lab and level 1 fieldwork. And level 1 fieldwork has both a community component, which is most of what you would do, and another component in which we provide simulated activities at the campus in which we can really present you with situations that will eventually turn up in real life, but they allow you to experience them in a safer environment, in a simulation. So for example, we just did mental health simulations this past semester, and a simulated client might be getting agitated, and there's a group and there are scissors and other potentially dangerous things on the table. So what does the therapist do in that case? Now, I worked for years in a mental health setting and had that happen maybe once, but it's important to be able to provide people with the opportunity to role play through that simulation so that you get a feel for how you can respond. We also videotape the simulation experiences for the most part so that we can watch them and students can give each other feedback as well as the faculty. So the 4 practice courses begin with mental health, then there's adult rehabilitation, geriatrics, and community practice, and the last is a pediatric practice. So each of those 4 has a separate level 1 component. Another course that we're pretty excited about that's starting for the first time in the fall is technology and innovation, in which people will be learning from a specialist in assistive technology about all of the different adaptations that we can make for people to accommodate any number of different impairments that are getting in their way from doing what they want to do. We are also really lucky to have 2 3-dimensional printers. So 3D printing is one way that OTs can create things that fit a particular need for a client or for a group of clients. We've also just started to collaborate further with the engineering and design programs, and in their department, which is just a block away, they have all these cool machines that can zip things out, laser print things on different sorts of plastic. There's all kinds of cool things you can do that we haven't even really gotten to start in yet. But that's pretty exciting. That's just another example too of one of the collaborations. Other additional courses that you may not get in a master's degree program have to do with advocacy, leadership, entrepreneurial skills. You will go through a sequence of 3 research courses with us. All of our students in a small group are completing a systematic review, which we anticipate will be acceptable to publication at the end. So this is a real scholarly contribution that students are making. The other kind of course that I feel is unique in a doctoral level program is that we have the time and space within the program to talk more and explore opportunities for OT within things like healthcare policy, health programming, societal and educational and other community-based programming where OTs can be useful, but may not necessarily already be. You will take a whole course on healthcare programs and policy. And I know when I've taught in master's degree programs, that's not something we had time for. You just have to provide people with the most important things that they'll use immediately in practice. But with the doctorate, you do have the opportunity to spend a little bit of extra time in an effort and research in that kind of field. And really one of the big outcomes that we expect from a doctorate is that you will be seen as a leader within your profession. And there are some jobs that are becoming more reserved for occupational therapists with doctorates, but it's really also a mindset of being able to advocate for your profession and the clients that you represent. It's almost always really needed. Our clients are often not able to advocate as much for themselves because of what they're going through. So how about the next slide?
So
Go ahead.
Yeah, I was just going to say there's at the end of your coursework, so once you complete all of the foundational and research and the basics that you need, students go on 2 level 2 fieldwork placements, and those consist of 12-week full-time placements under the direction of an occupational therapist who's licensed and been in practice a while. And it's sort of like an apprenticeship. You literally learn from the occupational therapist in either a community site or any one of the sites that we talked about. And the questions that I get asked most frequently are about where they can be and how they get placed, because that's what differentiates programs typically. So we do place nationwide. I know we do get people from all over the country in our program, and some of our students wish to go back to their home state, and I can usually make that happen for their practice in fieldwork. And I also think it's really important wherever you go and listen to fieldwork coordinators from any school that you are interviewing with or you're thinking about attending, always ask about how they place fieldwork. Because some schools do it on a lottery or a match system, a lottery system where literally your name is just put into a hat and I pull it out and I say, oh, Jimmy is going to Canada, and Jimmy goes to Canada and Joni goes to Arkansas, and that's how it goes. What I feel really strongly about is the fact that it's super important to match students with fieldwork sites based on both their academic ability and interests, as well as their personal interests in where they want to go to become an occupational therapist over time, as well as geography and experience. So if I have someone who says, I've worked in a school as a teacher's aide for 3 years, I only want to do pediatrics, I might broaden them a little bit and say, that's great, I'm going to put you in a pediatric setting that's similar to the school, but introduce you to something different, and then an adult setting, because we do train you to be generalists. But the match happens, that's my job, is to make sure that the fieldwork sites are matched to each student and allow for success and general learning.
Oh, we skipped over the doctoral capstone experience a little bit. Well, no, you spoke about it. Why don't we just, never mind, hold that for questions at the end. It's really not an additional fieldwork experience, but it certainly gives you more opportunity to really hone your skills, before you're getting out to a competitive work situation. So here you can see one of our laboratory spaces. This is a pediatric space with really a wonderful, fun equipment setup. A lot of the things are not even visible there. We will hook you up afterwards to make sure you have access to the virtual tours, which are available for the university as a whole and for the OT department. But also it's really great if, since you are not very far away, if you'd like to come down at some point once things are a little bit more normal, you can certainly schedule a visit. So a couple of the things that we're really excited about, I mentioned the 3D printers. We do have the full bathroom, living room, kitchen areas. A specific piece of equipment is a driving simulator, and driving is a specialty area of occupational therapy, and we're lucky to have Dr. Currie, who is certified as one of those specialists. But in the most part, occupational therapists don't get the opportunity to assess or necessarily train people using a simulator. So that is one of the things that is potential use to people in the community as well. We have specialized equipment for testing vestibular function, which has to do with our balance. I mentioned the 3D printers. We have a simulation mannequin. Her real name is Nursing Ann, but we call her Samantha. And Samantha is a mannequin who also can be programmed to have different kinds of blood pressures and to even speak through a remote device. And our colleagues in the physician assistant program are borrowing her right now. They can do all sorts of things like listen for heart murmurs and bowel sounds and all sorts of other options that are available with that. So we will certainly use the simulation mannequin on some occasions when we're doing physical disabilities practice. We'll also use each other as a lot of our practice. All of the labs are really designed to have people be safe and exposed to the latest equipment, but also see and use what is out there in real life. Another experience that people will have is to attend some activities or to even do a little cooking lesson in our culinary labs. Most of the Johnson & Wales culinary programs are in Providence, but on the kind of outskirts of Providence almost, where it's called the Harborside campus. It's right by Narragansett Bay. And these kitchens are just amazing. And we have had the opportunity to work with some students in culinary nutrition and dietetics. We've done we did like a chopped kind of food contest with them for one of the interprofessional activities. So there's just a lot of different opportunities available. The physician assistant program has a cadaver lab that they use for various parts of the body, obviously. But what we have been able to use through Dr. Currie is to be able to visualize muscles, joints, the different aspects of the body that would be useful in kinesiology, and to also return to that lab and again collaborate with the PA students in the neuroscience course as well. Okay, go to the next. So admissions to the Johnson & Wales class are always through OTCAS, which is the online common application site. Our segment opens in July and it closes in February. We select students from our applicants in order to bring them onto campus for a half day of interviewing. So you must have a bachelor's degree or be in the process of finishing it, and a cumulative GPA of at least 3.0. We'll ask you to write a personal statement. Yale will submit 3 letters of recommendations. And you will submit your official GRE scores, but we do not hold you to a specific percentile rank on the GRE. You can go ahead. So you can certainly ask us some questions about prerequisites if needed in a minute. We do need 2 semesters or a full year of anatomy and physiology with the lab. We need you to have developmental psychology or a lifespan development course, and 1 semester of abnormal psychology, and 1 semester of statistics, which could be biostatistics, psychology, it could be business oriented. You will build on those courses within our curriculum. Also, this has become a concern for some programs right now because some programs do require that you have some kinds of hands-on experience in the OT field or volunteerism. So we always consider that a great asset in our applicants. So if you do have the opportunity, if you haven't done so yet, I would really encourage you to try to get some experience or shadow somebody, but is not required for our program. Last but not least, it does cost money. We have really tried to keep our costs on the lower side. We know that our program is actually less than a couple of master's programs. And we tend to fall within the bottom third of OTD program tuition at this point, but this will give you the whole shebang as far as costs. We are waiting to hear what our scholarship allocation will be for the coming year, but we do have scholarship opportunities that are also available for the most qualified applicants. Okay, and the last thing to talk about is our accreditation process. So all occupational therapy programs have to be accredited by the Accreditation Council for Occupational Therapy Education. And you have their information here. We are in the process right now of completing a self-study, which details how we meet their standards. There's more than 100 different standards that we have to respond to and provide evidence for. We will be submitting that at the beginning of March 2021. And there will be a visit from accreditors that fall. So by the end of 2021, we will earn our full accreditation. It's extremely rare that a program like ours would not become accredited, and it's something that people would certainly know about in advance. We currently have candidacy status, which means we have been meeting the requirements and the milestones all along. We have a lot of support from the university. We have the time and expertise to put towards this accreditation. between my experience, Dr. Simon's experience, and other people from the program and the college. So we are pretty confident about that, but it's, you know, legally we do need to let you know that we are not completely accredited at this point, but certainly will be before the first class graduates. That's how it has to work. The courses have to be taught and the students have to work through the program before that accreditation visit happens. And you've probably heard that there is a national certification exam. Having a felony conviction will often affect your ability to take that examination. So if you have a question along those lines, you can obtain more information from NBCOT, or we could give you a hand with that. And I believe that's our last slide, right? Except for a quote that kind of embodies occupational therapy, that man or people would be the more up-to-date thing. Through the use of their hands, as they're influenced or energized by mind and will, can influence the state of their own health. We really feel that occupation is so key to the health of people, and we would love to help you learn how to, you know, enhance that for people. So at this point, that is our formal presentation. I will ask if other folks on the call want to make any other points at this time. And then we can not really hear or actually respond to questions in the chat.
If you have any questions, you can either use the Q&A or the chat, whatever works for you. I think the question I often get